Hi, everyone, and welcome back to the fourth annual Stanford Conference on Disability in Healthcare and Medicine. It's my distinct pleasure now to introduce Dr. Tal Jaris, who, together with her team, will be presenting on research-based theater disability disclosure. Take it away, Tal.
Thanks, Peter, and thanks everyone, and thanks for inviting us again. So I'm here zooming in from the occupied and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations here in what we call Vancouver. Grateful to live here and for them to take care of the land for so many years. So I'm part of the Alone in the Ring team. We performed a couple of years ago with Smarty, our theater play, and today we're going to do a research-based theater session around disclosure. So 4 of our team members are here. 5 of us worked hard on this session, including Lon Herschel, who couldn't be here today. And I'm going to pass it on to Christina to describe a little bit how this session is going to be.
Hi, everyone. Thanks so much, Tal. My name's Christina. My pronouns are she and they, and I'm so excited to be with you here today. I get to be your host / guide for this session of research-based theater, and I want to talk to you a little bit about theater and what we mean by theater before we get into the rest of the session. So maybe you've seen some big musicals, maybe you've seen a show on Broadway, maybe you acted in a play in grade school and had one line. This is all theater. And today we're going to be using theater from an applied theater tradition, a playback theater tradition, a forum theater tradition, and drama pedagogy strategies to explore disclosure and really dive into this topic. If you have no idea about those words that I just said, applied theater, playback theater, forum theater, don't worry, we're going to walk through it together. The main takeaway is that we get to create this session together. Unlike traditional theater practices where you're just the audience and you sit back and you watch, we really need your participation. So we're going to be doing some Slido polls throughout the session today to get your interactions. If we were doing this live and we were all together in the same space, of course, we'd be doing it a little bit differently. But just to get us warmed up using Slido, I want to launch a poll, which I believe you can see in your browser if you switch over from the Q&A tab. And the question on the poll is, how comfortable are you sharing personal information with a friend? And we have got some responses coming in. The options from extremely comfortable to not at all comfortable are varying. Great use of Slido, everyone. Thanks for diving right into this. Okay, we're landing somewhere around somewhat comfortable. This is also a good opportunity for me to say that I want you to focus on self-care in this session. So if I invite you to go fill out a poll and you don't feel like doing that, don't do it. I'm not going to know. If you need to take a break, move away from the session, go be somewhere else in the space that you're in, please, I invite you to do that. I have my tea, I have lots of liquids around me. Take care of yourselves first. So let's launch another poll. Here we go. How comfortable are you sharing personal information with a supervisor? Again, this is just getting us warmed up for what we're going to explore. We've got some responses coming in. Great, folks, great. It's going well so far. Okay. We're kind of landing for this one with not so comfortable or not at all comfortable. Okay, and let's try one more. This one's a little different. It's a word cloud. When you think of disclosure, what color comes to mind? Any color you can think of, but what color represents disclosure to you? We've got some votes coming in. Oh, look at all these colors. Yes, folks. Okay, red, gray, black, gray. We've got multiple blacks, brown. Ooh, yes, all these colors. Wonderful. Wonderful. Thank you so much, everyone, for diving in. So we're going to come back to these Slido polls as ways to interact and redo certain scenes and interact with characters from these scenes. So it's also important to really remember we're going to show some scenes, we're going to do a little bit of improvisation. All of these stories are fictional stories. They're based somewhat on some of our experience or our peers or colleagues' experiences, but we're playing characters. And first, we want to introduce who we are on this team. So I'm going to pass it over to Laura to talk about disclosure and begin the introductions.
Thanks, Christina. All right. So disclosure. Disclosure is basically telling someone something about yourself, particularly if it's something they might not already know. In this context of this conference, we're focusing on disclosure of something related to one's disability or health condition. Disclosure, of course, it goes across a range of experiences and identities. So we are going to engage in a little bit of disclosure as we introduce ourselves. I will start us off. My name is Laura. I go by she and her. I am a Dutch settler on WSÁNEĆ territory, what's now known as Vancouver Island in Canada. I identify as a disabled person, and I also am an occupational therapist and a scholar in the area of critical disability studies and access in health professions education. And I became an actor through my research as well. I am going to pass this on to Tal.
Hi, everyone. My name is Tal. I go by she, her. I'm a settler here in these lands. And I guess I experienced my first bout of depression when I came out of the closet as a lesbian many, many years ago. Since then, I see my coming out from the closet as a liberation, even though I still experience depression intermittently throughout my life. I'm going to pass it on to Yael.
Hello, everyone. My name is Yael Meyer. This is how it's pronounced, Yael. I'm a daughter, a sister, a mother of two lovely girls. Just went to sleep because I'm joining you from Israel. I'm a clinical psychologist in my profession. I had the honor to do my postdoc fellowship under the supervision of Tal and to work with this amazing team for a long time. This is how I also became an actor. And now I'm a faculty member at the University of Haifa in the Department of Counseling and Human Development. And I also am living with a disability, a mental one and a physical one. And I'm very happy to join you today. I'll pass it on back to Christina.
Thanks so much, everyone, for introducing yourselves. I have to say, just going to take a moment. I love this team. I love that we all get to work together doing work like this. I'm really passionate about this work. So this is why I'm so excited to be here. I am also a settler. I live in so-called Vancouver. And as a trans woman, I think disclosure is something that I think about every day as I move through the world and walk down the street. And I think about how whether we speak out, whether I speak out when someone misgenders me or I don't speak out, those are little moments of disclosure, and those moments add up to a lot of different things. And I hope that we can talk about all of the different facets that we all experience around disclosure as part of our session. And I hope you can dive into these conversations more after the session. So let's get started with our first scene. Our first scene is going to be shared with us by Yael and Tal. Yael will be playing a character named Angela, and Tal will be playing a character named Professor Smith. So this is about a student coming to a virtual office hours with a professor. Let's watch.
Hi, Professor Smith.
Hi,
Hi. I'm here for the open office hour.
sure.
Is it okay?
Yeah, sure. It's my open office hour. Can you please remind me your name?
Yeah, it's here, right here on the Zoom. I'm Angela Ricketts from your anatomy class.
Oh yeah, of course, Angela. How can I help you?
Okay. So it's about the tests. I'm finding things really challenging.
Wait a second. Let me pull out your file. I actually see that your grades are fine. Yeah, you have nothing to worry about, Angela. You're doing well.
Oh, yeah, but I am worried that it won't stay like that. As the course goes, then it becomes harder and harder, and we have more and more readings.
Of course. After all, you are in a medical school, Angela. So obviously it's going to get harder and there will be lots of reading. Yeah, that goes with the territory.
I know. I realize that, but I was hoping that we can discuss some accommodations, maybe.
Accommodations.
Yeah.
When I went to medical school, nobody spoke with us ever about accommodation. Now every student wants to talk to me about accommodation. So what do you mean by accommodations? Like, do you want me to make special arrangements for you, or what is it?
Well, yeah, I do have ADHD, and because of that, I sometimes read slowly.
Oh dear. Okay, so is this an actual diagnosis where you have been assessed for that?
I was assessed for that.
Okay. So have you informed anyone at the university about it? Like, do you have a letter or something?
No, I was diagnosed, but I didn't even want to make it formal. I don't want it in my file. I don't really want everyone to know about it. So I just thought maybe we can discuss some accommodations, something that would be possible and feasible that could really, really help me. Like maybe just a little bit of extra time before tests or something like that.
Sure. I fully understand. Yeah. So let me be perfectly honest with you, Angela, if I may, obviously. And,
Of course.
and only because I really think of you first and I do care about you. So, this discipline is really, really hard, as you probably experienced. And it's not just about the medical school, but then later on when you graduate and you go to be a physician, tons of reading, tons of patient files, I really don't know how it's going to work. Even if you have a letter for your accommodation, in the real world, it's going to be really, really hard to accommodate you. So
I see.
Yeah. And, I'm wondering if you might want to consider a different path, because it's going to get harder and harder. And I'm just worried about you, really. I do care. So
no, well, that was my dream, being a doctor.
I know. No, I'll tell you something I tell my own kids, not everyone needs to be a doctor. There's so many other professions out there. I would encourage you to think about other possibilities.
I see. Okay.
Yeah. And just so you know, not me, but not everyone will see it in a good faith of getting extra time, for example, your peers, the other students, might be offended about it or be like, why does she get more time and I don't? So it can get really messy. So you might get into trouble with your peers. So yeah, I really don't know.
Yeah, well, I understand.
Yeah.
I understand. Thanks.
Oh, you are welcome. Lovely talking to you.
Thanks to you too. Thank you for your time.
Angela.
Bye.
Bye. What a lovely girl, really nice girl. I don't know, hard time.
And scene. Thank you for that scene, folks. Okay, so I want to invite Laura on now so she and I can talk about what we saw there. Oh my gosh, Laura. I was sitting there watching that scene and feeling like,
cringe.
Yes. What did you see?
Oh, goodness. Oh, well, I saw a prof who is very old school and doesn't quite understand disability or doesn't understand how to receive a disclosure of this kind. I also saw a student who is courageous in even asking for these accommodations, but also who perhaps doesn't have the confidence or the skills or the social capital that they need to push this further. and this prof was really enacting ableism in kind of a subtle way. They were really nice, but it's tough to counter that ableism in that moment when it is so subtle and in a nice veneer.
Yes, yeah, there was that veneer there that was kind of disguising it. And I don't know about you, but I just saw that student get quieter and smaller and smaller. And that, I feel like that resonates. I haven't been in this exact situation, but I have been in conversations with profs where you just get smaller and smaller and smaller. So that really resonates with me. Laura, if you could say one thing to this prof, what would you want to tell them? What would you want to say?
To the prof?
Yeah, to the prof.
Well, I would probably invite them to kind of reflect on that interaction and how they might have been impacted if they had been in that situation. Yeah, I think it was it was really tough for the student, and perhaps for that prof to start to understand a different perspective.
Right.
The other side of me would want to come in blazing, and maybe talk about microaggressions and how those are enacted.
And what would you say to Angela? What would you say to the student?
Well, first of all, I'd say, I'm sorry, that was a really awful way for the prof to treat you, and they didn't respond well, and you were doing everything right. And I think I would invite them as well to have a conversation about, what would you like to do next? How can I support you and make sure you have the support that you need? And talk about disclosure and some of those pros and cons of disclosure as well.
Okay, yeah. So really leaning into that support piece. I really hear that. Thanks so much, Laura, for talking with me about this.
Absolutely.
So folks, now we really get to lean into the magic of theater. I'm going to invite Angela, a character from the scene, back to have a conversation with us. And there's a pull up in Slido where I'm asking you to share what you'd like to share with Angela, what you would say to her. And we're going to talk about those things. Hi, Angela.
Hi, Christina. I'm back.
Thanks. You're back. Thanks so much for joining us and for being willing to talk to us. I really appreciate it.
Of course.
So we just witnessed what happened between you and the professor, and I have to say I was really I was so my heart was going out to you as you got quieter and smaller through the conversation. What was your experience of what happened?
Yeah, well, I just wanted to get out of there. I couldn't close the cameras, as fast as I could. I felt I'm becoming smaller and smaller, and I felt it was hard because the professor was on one hand so nice, but in her tone and in her kind of like in her attitudes, but the content of the things she said were very aggressive and very degrading. You might want to choose a different profession, or these were hard things to hear. And these are then these relationships, I can't say much. I'm the student. What can I say? But thank you,
There's a real power differential there. And we've got some messages coming in from folks who are watching and listening.
Great.
Can I share some of those messages with you?
Sure.
Some of the things they want to say. Great. Okay. Folks are saying, I love your openness. Stand up for self-confidence. Other folks are saying, you took the first step, and that is progress. And another person wants you to know, Angela, you can make it and be a highly successful as a doctor with ADHD.
Thank you. Thanks.
Yeah, how is it to hear all this? How is it to hear those words?
That's good. It's empowering. It's validating. It's very nice to hear this, these validating comments. So thank you all.
Yeah. Angela, I wanted to check in with you about something. I noticed as part of the conversation, you mentioned that you hadn't disclosed to
Yeah,
the services at your school that might be
yeah,
uh, keeping track of that for students
yeah,
with disabilities. So
yeah.
you hadn't talked to those units, and I wanted to
The
hear a little bit
accessibility
more
center.
from you.
Yeah,
Yeah, yeah.
yeah,
Tell me
yeah.
a little bit more about that.
Yeah, I had a lot of thoughts about it, and there are two sides. Like on one hand, I do understand that if I want to get the accommodations and the extra time that I really need, and it is fair, not like the professor said, because I'm not starting at the same point like everyone, and to get me to this
Mm-hmm.
point, I need those accommodations. And I do have a formal letter and everything. So I realize I will have to go to the accessibility center eventually, and I know it. But on the other hand, I'm so worried to be tagged. It's the medical community in my university is so small. The preceptors and the clinical instructors, they're part of the hospitals. Everyone knows everyone. And it's something I need to balance, the risk,
Yeah,
like the
yeah.
benefit of getting the accommodations with the risk of being tagged and being known as, oh, this
Mm.
one has the ADHD. And I don't want to be, people to look at me and say, oh, she will make like a lesser of a doctor because she has ADHD. So I'm trying to balance those risks and benefits of the disclosure.
Yeah, I really hear that tension in what you're saying. I just wanted to share that there's folks who are offering what they would suggest you do if you find yourself in this
Great.
situation again. And some people are suggesting contacting the Disability Resource Center at your institution. But there's also people who are saying they know many doctors with ADHD, and I just want to highlight this for you. And they have
Mhm.
been very successful. And there's also suggestions to talk to an advisor or a school
Mhm.
counselor who's part of your faculty or your
Okay.
department. Does that feel like something that you would be able to do?
I think I still need to think about it and to kind of like digest this idea of going to the accessibility center.
Yeah.
I might I think going to an advisor would work for me because it's just a
Okay.
conversation. Nothing is formal. Nothing is, I think so. So I think that's a
Yeah.
good idea for me. I do need to find some support, somebody that will understand me. I don't know, maybe I remember there's a professor who said once they do have ADHD, I might want to speak with them. So thanks. I
Okay.
think,
Yeah.
yeah, good ideas.
Yeah. There's some other suggestions coming in of finding a mentor and an ally. And it sounds like you might have someone in mind actually who could potentially be that person for you.
Yeah, yeah, I'll try to approach them. It was meaningful when they said, I have ADHD, so it's hard for me that, and I was, wow, they
Yeah.
have that too. That's amazing
Yeah.
to know. And I thought, that could be a good mentor. Maybe I'll try to approach and see if they can maybe give me some advice and help me in this situation.
Well, thank you so much, Angela. Any final thoughts before we move on?
First of all, thank you, and thanks for these wonderful advices. And I'll really think about everything. And I'm just thinking about the journey. It is, like it's not one
Mhm.
point that you think of what to do. It's something I realize that we'll have to just consider along the way in every situation, what to do, how to disclose, who will be my allies during the internship, the residency, and it's probably a journey.
Yeah, yeah, I think it will be a journey. And like folks are saying, like the comments that have come in, you're already on that journey. You've taken the first step.
Yeah.
Thank you so much,
Thank
Angela.
you. Thank you
Great
so
to
much.
chat with you.
Thanks for me too. Bye.
Bye-bye. Okay, everyone. So we're moving on from our first scenario to our second scene now. Take a breath, just check in with yourself. How you feeling? See if you need to move at all. If you've been in the same position for a little while, move a little bit as we switch to new characters and a new scenario. This next scenario has two residents as the characters. So Yael and Laura will both be playing residents who are working together, and we're going to see what happens. Let's watch.
Okay. Hey, Tamara. So the virtual case consultation starts in a couple of minutes. And I just wanted to make sure you have everything you need from the patient's file.
Yes, I'm just getting the last couple details from the file.
Okay, wonderful. Can I help you with that? Because, you know, we really have to go. The consultations are starting. Are you good?
No, I'm fine. I just need to make the font a bit bigger.
Oh, did you forget your glasses? You know,
No,
just don't have much time.
glasses don't help.
Oh, okay. You know what? I'll just do it myself. Okay. Wait, I'll open the file and I'll get it done. Okay.
No, it's fine. I really can manage with the Zoom function. I just need to get one more detail out of here.
We really don't have time, you know, and you don't seem to be managing. And the attending doctor is just going to blow up if we don't go right now. So you just need to look into glasses or something.
So I have low vision. It's permanent. Glasses don't help. As long as I get my assistive technology to work, I can do it myself, and I'd really rather go that way.
Oh gosh, I didn't know. Sorry, no one really told me. Why didn't you tell me?
Well, because I'm managing and there isn't really any problem. I have the zoom in option, and so there's not a problem.
Oh gosh. Well, okay. You know, okay, let's just get the information. I feel like such a jerk. I didn't know. Nobody told me anything. And I mean, it's not an issue for me at all, but I should have known. So we really need to go right now. So did you manage to get into this file?
Yes, it had just kicked me out, so I was logging in again. Just checking the latest nursing note, which should
Okay.
be.
It's right there. Right. You know what? I'll just do the notes from now on. Okay. I'll get us ready and I'll just do it.
And scene. Thanks so much, both of you, for sharing that scene with us. Another kind of disclosure, another kind of scenario, this one between two residents. And again, I want to give us the opportunity to talk to both of these characters. And I'm going to put up another poll in Slido before I bring them back on. What could the residents have done differently in this situation? So go ahead and take part in that poll if you feel like it. And I'd like to invite both Tamara and Lee to come and join for a conversation now. Hi, Tamara. Hi, Lee. Hello.
Hello.
There.
Thank you both for being willing to talk to me. We just watched that exchange and it was a pretty intense situation that you were both in. Tamara, can you tell me what was going on for you? What was your experience of that interaction?
Yeah, I was feeling a bit kind of frustrated. The system wasn't working right with my assistive tech, and then, I just needed to like focus and get it working, and it probably would have taken a sec just to do that. But then I just felt like I had someone who was badgering me, and it made it impossible for me to do it.
Right.
Yeah.
Yeah. Thanks for sharing that, Tamara. Lee, I mean, I know you're hearing what Tamara is saying from your perspective.
Yeah.
What was happening between you two in this interaction?
Yeah, I felt very stressed. I felt like I'm responsible to get us ready, to be really good with the attending that is already a bit of like thinking that we're slow. And I was feeling I have the responsibility to get us on time and get us ready. And the disclosure was like caught me unready, very surprised, and it's like another thing I have to deal with right now. Really thinking about my stress and my task, and not really like right now I'm like not on focusing on anything else.
So the situation was just so high stress. Yeah. And Tamara, from your perspective, listening to Lee, this high stress situation, what would have been supportive to hear from Lee in this interaction?
For me, I think, well, first of all, to just trust me when I said I've got it. I just need to get one thing and just let me do that.
Okay.
And you don't need to deal with it. I'm dealing with it. And it's under control. And I think yeah, so to just kind of pause and step out of my business in a way.
Mhm.
Um yeah.
I think that pausing is really important. And we've got suggestions coming in from folks who are watching of what could have happened differently. And I want us to draw on what you're talking about right now, that pausing and some of these suggestions to replay the scene. So let's start the scene again from the very beginning. And this time, just for the sake of replaying, Tamara, why don't you disclose at the very beginning of the interaction? Is that all right with you?
That sounds good.
Okay, and Lee, I want you to drop in some suggestions that we're receiving. Patience, going in with
Okay.
patience,
Okay.
slowing down, and not acting like a professor in this situation, acting like a fellow resident.
Okay, I'll try.
Does
Okay.
that make sense?
Yeah, sure.
Okay, let's see what happens. I might interrupt, so I'm going to
Okay.
stay on camera just watching, okay?
Okay.
Okay.
Okay. Hey, Tamara. So remember the virtual case consultations, they start in a couple of minutes. I just wanted to make sure you have everything you need from the patient's file and everything.
Yeah, thanks. Yeah, so I have low vision and I use assistive technology and it just
Oh.
wasn't playing nice with the system, but I just need a couple of
Oh.
minutes to get it up and running.
Okay, can I help you with that? Because we really have to go. The consultations are starting. So like can I just do it?
Okay, pause. Great. Tamara, thanks for doing that disclosure, making that change in the scene. Lee, I just want you to drop in, like literally take a breath. Like let's literally slow down and take a breath and see what
Okay.
happens. Yeah.
Okay.
Yeah.
Okay, so
You know
slow
what?
down even more.
Yeah.
Okay.
Yeah. And Tamara, you can take a breath too. Let's all just take a breath. Yeah. Yeah. Let's go from the same place
Okay.
where we stopped. Here we go.
Okay. Okay. Hey, Tamara, how are you? How are you today?
I'm okay. I'm just I use assistive technology because I have low vision and the systems weren't playing nicely together.
Oh.
So I just need to get it working.
Oh.
And it'll just take a couple minutes.
Okay. Okay. So you're taking everything you need, right? From the patient's file. Like you're okay with that,
Yeah.
right? Okay.
Yeah, I'll get
Okay.
it all, I think.
Okay.
Yeah, sorry,
Okay.
it's just taking an extra minute,
No,
but
that's okay. That's okay. Thanks for letting me know. I didn't know. It's good you're having the assistive technology to help you with that. Thanks
yeah,
for sharing
usually it
that with me.
works.
Yeah.
Yeah, you
Technology
know,
never works
technology.
when we need it, right?
Yes.
Okay.
Okay, pause. Okay, what's happening now? This feels totally different than the first interaction I saw. Tamara, what's going on for you?
Well, I feel like it's kind of a more human interaction.
Uh-huh.
And I feel like you're kind of trusting me a little bit more and yeah, especially as a first year resident, I'm kind of in that strange place of feeling like an imposter, but yet I know that I can do these things. So it's really helpful to have that support. Yeah.
Yeah. And what about for you, Lee? What are you feeling that's different?
I really tried to get into this position, like the advice I got, to kind of like feel like, okay, you're not the professor here, you're more of a colleague, and lighten up a little bit the conversation, and also realizing, wait, Tamara just shared with me something really meaningful that she's using. That she has low vision, she's using assistive technology. So I have to also acknowledge that she just did share with me something important. So I kind of like, tuned into this position of something more equal in our positions, and also trusting her and saying the task is for both of us, not just for me to prepare, and trusting her that she's with me and we're doing it together, more than me responsible on her.
Yes, I love that thought of doing it together. And this is something that you're both working on together. Thank you both for
Thank you.
taking part and talking to us and sharing with us. And we'll move on to our third scenario now, everyone. So this is our third and final scenario. And this scenario involves two colleagues who are doctors, and they work at the same institution. Tal will be playing one of the colleagues, and Laura will be playing the other colleague. And we're going to find out what happens when disclosure occurs in this situation. Let's watch.
Hey, Jen.
Hey, Robin, how are you?
Oh, I'm pretty well. We missed you last month. I mean, it's fine. I think we can still get back on track with the timeline for the project. How are you doing? Did you get that flu that's going around?
No, actually, it's not the flu. I'm okay. It's not the flu, but it's something else. But yeah, well, you know, I've got some health issues that I'm dealing with, but yeah, I'm okay.
Oh gosh, I'm so sorry about that. What kind of health issues? Is it serious?
Yeah, it's pretty serious. Yeah.
Oh gosh. So you're taking a medical leave, I guess, because well, I think I could still ask about, someone else to maybe co-lead the project. I think there's still time at this point.
No. I'm not taking a leave, and I'm fully committed to this project. I'm working with my physician to figure out things, so I'll be okay. Yeah.
Oh, okay. So how serious is this thing? What's going on?
Well, I guess I can trust you, right? They think it's MS. I'm not committing to this diagnosis right now. It's still under investigation, but yeah.
Okay. Wow, but it's just, yeah, that's awful. But the timelines for the project are also, they're pretty sensitive. And I feel like if you're going to end up taking a leave or needing to be away or missing things, I also don't want to jeopardize the project and
Yeah,
your own health. And
yeah, Robert, I don't think I'm going to jeopardize the project. It's just, I've got an ongoing thing, and it's something that I'm going to need to live with, and I'm working with my physician to sort it out. So
okay, I see. I'm sorry. That must be really tough, considering how hard you've worked to get to this point in the career. And I mean, to have to take a new direction at this point, that's awful.
well, I'm not considering a different direction. I have some pain and things, but we'll get it sorted out. Do you think I need to consider a different direction? I hadn't thought about it. Oh my God.
No, I always say it's so important to be practicing safely and effectively and efficiently and all that. So
Yeah.
I think if you're at a point where you can't do that anymore, you probably need to take another direction.
Yeah. I am practicing safely, aren't I? I just need to get everything sorted out with my medication and things, and it will be okay.
And have you reported it to the college?
My specialist is sorting it out, so I think it'll be well managed. As once we sort out the medication, we also caught it really early, so yeah. So
okay, well, if you're sure it's well managed and doesn't affect your work at all, then I think it should be okay. But don't tell anyone else. I think people talk, and I think they'll question your capacity, and we can't afford to have anything jeopardize the project. So I would say definitely keep it to yourself.
And scene. Thank you both for that scene. Okay, folks, another question is coming in Slido. What could have happened differently? what could have happened differently in this situation. And just like last time, I want that to have the chance through the magic of theater to talk to both of these characters and hear from them, from their perspectives of what was going on for them in this really complex interaction. So I want to invite Dr. Robin Murphy and Dr. Jen Skipper back on to talk to us, if that's possible. Hi to both of you. Thanks so much for being willing to chat with me. Hello.
Hi.
Now, hi. Now, Dr. Murphy, maybe I'll start with you. Can I call you Robin? Is that okay?
Yeah, for sure. No problem.
Great. So Robin, I just wanted to, this is an interaction between colleagues. I get the impression that you two have been friends for a while as well. This is a complex interaction. What was going on for you?
Oh gosh, this was like a huge shock, really. I think especially having gone through some of our residency and stuff together, I think yeah, it was just a shock. And I think I also am leading this project, and it's really important to me. And so I was also concerned that, like, I know MS. I've seen it. I've seen it in patients, and how it can change someone's life, and they might not be able to do stuff anymore. And yeah, so it was kind of a blow emotionally, and also like to my, okay, well, now what are we going to do for the project?
Right. Yeah. Thanks, Robin. What about Jen? As you're hearing Robin, let's hear from you. What was going on for? Oh, I mean, can I call you Jen? I'm sorry, Dr.
Yeah.
I should have checked
No
with you
worries.
first.
No worries. Yeah.
Thank you, Jen. Can you share what was going on for you?
It was very very painful. It's the first time that I shared with anyone, and I consider Robin a friend, so I sort of felt safe to share with her. But I felt like she only think about the project. She doesn't think about me and what I'm going through as a friend. She really scared me, like thinking about changing a career path, talking to the college, not being safe with patients. It was like really, all the fears that I had with when I need to disclose to people, like instantly came to life and became reality, and in all places with a friend. So that was really scary.
It sounds really scary. That's really coming across. And I'm curious, we've got some suggestions coming in about what could have happened differently in this scenario, in this situation. And I'm wondering if we can go back to that moment of disclosure and try something. So Robin, some of the suggestions coming in are to be a friend first rather than a colleague in that moment of disclosure. And I just want us to try that. What happens if that's what you're going for in that moment? Does that make sense to you?
Yeah, I think so.
So can we go back right to that moment of disclosure, that moment, Jen, where you share for the first time? Is that okay?
Sure. Yeah, so I'm going through some health stuff, Robin, and my physicians think it's MS. So
oh my gosh. Oh, Jen, that's huge. How are you dealing with this?
It's scary. It's scary. It's earth-shaking, right? Kind of news. But I'm hopeful. I'm doing really well. They discovered it really early, so there is really good hope with the medication that it wouldn't impact my functioning for a while.
Yeah.
Gosh.
Is there anything you need? Like, do you need any support or anything I can do?
Yeah, thanks for asking. I think for now I'm good. I think for our project I'll be okay. But it definitely, I'll keep in mind if I need any help, I will definitely reach out. Yeah. So I think I just need to rest here and there and so forth, but I think I'm good. So
Yeah, well, let me know.
Thanks. That was very different, that interaction. How did you feel about what was happening, Jen, that time?
oh, it was much better. I felt like Robin is back as my friend rather than worried about the project. So it's made disclosure and sharing what I'm going through much easier.
And Robin, how did it feel for you?
It was in some ways it was harder because I could separate out kind of the emotional part of it when it's like, okay, like focus on what do we need to do, like, kind of I do that in practice. Like I can't get emotionally involved in every patient situation, so I choose not to, and I kind of separate and so it's easier to do that in that moment, but it's also so it felt more emotional and more difficult, but kind of in a good way too, because this is my friend, and I don't want to lose the relationship either.
Yeah. Well, thank you both for sharing with us. I appreciate it. Okay, folks, we've come to the end of our time together. We've just got a few moments left. I want you to check in with yourselves and see how you're feeling now, where your breath is for you, if you need to move at all, what feels like self-care right now. And I'm going to invite everyone in my team to come back on, turn their cameras on and their audio on for one last time, just to share any final thoughts on disclosure or the work that we've all been exploring together in this session. I'll pass it to you first, Laura.
Okay, so thank you for engaging with us in that. Disclosure, we could talk about it all day. In some ways, we have been talking about it all day. I think something that's been really important in my journey is realizing that disclosure is something I do every day, multiple times to the same person. And so, yeah, it's something that doesn't go away. And it's not a one-time deal. And so it's something that I'm needing to reflect about a lot. And being able to reflect with someone else, I think is really helpful for me. So it's one of my thoughts. I have many, but I will toss it over to Yael.
Thanks, Laura. I was just reflecting on how this session is so personal for me. I recently went through a period of time where I had to go to a medical leave because of my disability, and I had to disclose many, many, many times. It was exhausting. And I was thinking that I think the best, like what worked best for me was really that people were empathetic to the situation, really first of all talked about what I just shared just as human beings, and were supportive, and that was really helpful. And also that people really asked me what type of support I prefer and I need, and that was really a huge help. And the second point is that I was reflecting on how disclosure we can meet in both ways, as someone that is disclosing and someone who's other people disclose to, and just reflecting on how we react, what do we do, how we offer the support in the best way we can. It is a journey on both of these roles. So thank you for this opportunity. So I pass it on to Tal.
Thank you. Yeah, so similar impression. I think for me, disclosure, the main burden of disclosure, that it's ongoing. It's never ending. It's constant. So every time you meet someone, a new person, new situation, it's ongoing. And one thing that I want to reflect on, learning through the process while we prepared for this session, is realizing how important it is to try to understand the other side. So the other person that you're going to disclose to, and understand what are their motives and what pressures are they under, and what is their background, and what might impact what they think, and be prepared for that. And I think will be really, really important to make the disclosure a bit a different experience. And also sort of reflecting on, we did 3 scenarios, we sort of, the 2 of them we enacted again, and found some ways to make them easier and better for both sides, realizing and acknowledging that in life it's not going to be that's simple and smooth, right? It might not be, Dr. Dr. Murphy might not be as nice instantly. It's going to take time, but just realizing that there is a hope, and there is as I said, it's not a one-time thing, disclosure. You have to go back and have further and further conversations to resolve issues. So yeah.
And building on that, Tal, like in terms of a suggestion, it can be really helpful to do this. Play it out with someone, practice the disclosure, and then also that gives you that chance to start to build empathy and think about what are my interaction partners' motivations and pressures and tensions that they face in their life. So find a friend, do some role play.
Yeah. I'll add to that I think from our research, and because we are dealing with it for a long time in our studies, and also from personal experience, I think that finding really an ally, somebody that can understand you, but also understands the system and can really provide good advice in terms of, like Tal said, like understanding what are the pressures, what are the interests, what are like the diplomacy of the situation, and can really provide good advice on how to disclose and what exactly to ask, and what you can ask from each of the persons of the accessibility center, or so just somebody that can help you think the situation, and also plan some of the disclosure to be in your best interest. So I found it also helpful for myself.
Thanks so much, everyone. And thank you all for taking part and witnessing these scenes. We really appreciate it. And we're going to pass it back to Peter.
Thank you.
Thanks so much. Wow, that exceeded all of my expectations. The theater and the performances have a way of hitting you in the heart in a much deeper way than just watching data or words on a slide. Amanda Taus, I want to read a comment that she made about this fairness issue. And she says, I increasingly find that the ubiquitous burnout and precarious social support underlie the critique of fairness. Institutions are not actually fulfilling their ADA obligation, and instead just shifting the burden. So an accommodation for one resident, it should be facilitated by the hospital employing them, not by asking everyone else to do more, especially when their schedules are already humane. And I couldn't agree more with that. And that's like one of the, I think, main roadblocks to disclosure, is that we don't want our colleagues to have to do more. Not taking overnight call. I don't want my co-residents to go from Q4 to Q3. The hospital should be replacing me with a PA or an NP or another doctor, and pay for that accommodation rather than just dumping on the rest of my peers, which is puts me in an awful position. So thank you so much